the Resource Center expand their behavioral health services?
I'm Aya Mahaffal. I'm a senior at SMU currently studying biology.
I'm Yolanda Deva, and I'm a senior at SMU studying psychology.
My name is Jessica Chu. I'm a senior at SMU studying biology.
I'm Michael Iowa. I'm a junior studying finance.
And I'm Tyler Frisky. I'm a senior studying mechanical engineering.
So what is the Resource Center? The Resource Center is a trusted leader that empowers the LGBT and HIV community by improving both their health and their wellness. They are currently located on Reagan Street in Dentwood Triangle, and they were founded in 1983. Currently, they serve about 60,000 people and provide services such as the Hot Meals program, HIV dental care, HIV testing, and the food pantry. The Resource Center currently broke ground on the corner of Inwood and Cedar Springs, and they serve about 90% LGBT and 10% straight communities, and they are looking to expand upon more culturally and fiscally diverse demographics.
So when we sat down with the Resource Center, they expressed a desire to serve a population that they're currently serving, as well as a population with a median income 300% above the federal poverty guideline. And when we heard that, we were really trying to paint a picture of what that really looks like in Dallas. So we took the average number of people in a Dallas household, which is 3, and found the federal poverty guideline for a household of 3, which is around $20,000, and multiplied that times 3, giving you 300% above. So that is about $60,000, and we found that 43.7% of the Dallas community has a median family income above $60,000. This means that there's potentially half of the Dallas community could potentially tap into to serve and provide these services for. When we spoke with Sabine about the SMU counseling program, we learned that there are currently 5 counseling interns and 1 supervisor that serve 250 clients through referrals from the Resource Center. They use a sliding scale payment fee of $0 to $50 with an average of 15. They serve a wide variety of demographics in different settings, and they utilize the Reagan Street location. Another great thing about the Resource Center is they currently have approximately 1,100 volunteers annually and help with various programs that were mentioned earlier. I know that when we all helped out at the Resource Center through the Hot Meals and food pantry, we really felt like we were part of the community, we could feel the love, and we really hope to continue serving with y'all.
So our challenge is to help the Resource Center expand their behavioral health services and ensure that they're easy to implement, revenue generating, and of high quality. We recommend that the Resource Center do this through the implementation of both Resource Center Behavioral Therapy and the Be Well Health and Wellness Program. Resource Center Behavioral Therapy is a counseling practice comprised of 2 licensed professional counselors that provide high quality care and a medical secretary that schedules clients and negotiates claims with third-party payers. This practice would be housed at the new Resource Center location currently under construction. Clients would pay for services one of 2 ways, either through third-party payments or medical health insurance. This would attract middle and upper income individuals, a demographic that the Resource Center is currently actively seeking out. If a client did not have mental health insurance, they could opt to pay an out-of-pocket flat rate of $125 per session. This price is designed to undercut competitors while still providing the Resource Center a robust net annual revenue of $180,000. Our revenue model is based on a 35 client per counselor per week caseload. This is a typical caseload for a licensed professional counselor. Our expenses include salary and benefits, liability and malpractice insurance, and a practice management system that allows these counselors and the medical secretary the ability to organize patient files. The gross annual revenue of our model is $300,000 with expenses at a little under $160,000. We've also included $1,000 in initial startup costs to cover basic startup business costs. The relationship that the Resource Center currently has with the SMU graduate counseling and the Simmons School will remain intact with a few minor adjustments. SMU graduate counselors would work after hours and on weekends at the new location and as is at the Reagan Street location. The current sliding scale payment model would remain intact, however, we would move the high end from $50 to $150. This would prevent cannibalization of our core business. This would also act as the philanthropic arm for the Resource Center Behavioral Therapy, as it allows the Resource Center to provide low-cost or zero-cost counseling to those who could otherwise not afford behavioral health counseling. Potential scaling is also included in this model to include other volunteer counselors and students from other universities to service demographics currently untapped by the Resource Center. The expansion in infrastructure with the new building also allows us two incredible opportunities to expand upon the great work the Resource Center is currently doing. The first is that the infrastructure provides the opportunity for the Resource Center to become the leader in LGBT competency training. This would improve mental health counseling for the LGBT community at large and increase tolerance and understanding between the LGBT and straight communities. This program also affords advocacy through analysis. According to the American Psychological Association, there's a higher prevalence of mood and anxiety disorders, along with substance abuse in the LGBT community. This program would be the source for grants investigating these challenges and could strengthen the Resource Center's already incredible advocacy work. In summary, Resource Center Behavioral Therapy stands to make the Resource Center $180,000 in net revenue. This program would allow the Resource Center to provide high-quality care without abandoning current clients or existing relationships.
In order for the Resource Center to be most effective in providing behavioral health services, we recommend a holistic approach to health. In this doing so, we would have behavioral therapy combined with the Be Well program. Be Well is a program that has three factors. It would have education with health living workshops, and we would have alternative behavioral health therapy through music therapy and art therapy, and we would have fitness through a fitness program. In regards to education, we recommend a partnership with the students from UT Southwestern, Parkland, UNT, and other certified schools in areas such as nutrition and medicine. These volunteers would provide health education classes and workshops such as nutrition classes, healthy lifestyle classes, and cooking classes. They would also provide monthly talks about different aspects of health with topics ranging from safe-sex behavior to ability to find balance in life and education on medication for newly diagnosed HIV patients and topics of the like.
There are two approaches to behavioral health, the first of which is art therapy. A 15-minute group session costs about $45. We plan to ticket prices at about $15 monthly. This would allow us to break even at about 3 clients and then generate revenue at about 4. Music therapy is the next alternative. Music therapy is known to treat depression and anxiety and other mental health illnesses. A group session can cost anywhere from $130 to $200, and we plan to ticket prices at about $35 per session monthly. If this proves to be too pricey for clients, an alternative would be to partner with the SMU music therapy program. The $35 cost per client would allow us to break even at about 4 and generate revenue at about 5.
In regards to fitness, we recommend that the program would be coordinated by volunteers, and we would have a $5 membership fee per month per individual for all the exercise services provided. In regards to location, in addition to utilizing the Resource Center at the new location for space, we recommend community partnerships with organizations such as North Haven Church, Cathedral of Hope, Cloudwarren Park, and Dallas ISD schools and places of the like. In regards to the fitness services provided, we recommend 3 different services: yoga classes, running groups, and Zumba classes. From our research, we found that 44% of people who practice yoga earn more than $75,000 per year. With this understanding, we realized that people from lower socioeconomic statuses and underprivileged backgrounds may not be able to access this resource. So by incorporating yoga classes into the fitness program, we believe we can provide access to a resource that otherwise would be inaccessible to this demographic. In addition, we found from our research that those who run between 20 to 30 kilometers per week have better immune systems and are less likely to get sick. This aspect of the program would be especially beneficial to those who have been diagnosed as HIV positive and utilize the resources at the Resource Center. In regards to generating revenue, we recommend community partnerships with current donors and supporters. Basically, we recommend that these supporters would incorporate Be Well as an employee benefit, which would generate revenue for the Resource Center.
As you can see, we estimate an annual net revenue from the fitness program to be about $880, from the art therapy program to be about $180, and the music therapy program at about $540. This brings our total annual net revenue to be about $1,600. The fact that this generates revenue also allows for sustainability in the future.
We have also provided you all with a potential flyer with our services, and overall, through health education classes and education, alternative behavioral health therapy, and education, we believe that Be Well is a program that will bring communities from different areas together with a focus of obtaining optimal health. Also, we would provide access to communities who otherwise wouldn't be able to access these services.
In terms of creating demand and looking at the potential market analysis, we found that a little over 70% of the Dallas community is actually insured. They have either privately through their employer or through the government. There are also 20.4% of residents that say their mental health was not good for 5 or more days in the past 30 days. And this is according to the Dallas Health Needs Assessment. And there are only 3 outpatient behavioral health providers in the Dallas area that are funded publicly by North Star. These all show that there's a great potential for the services that the Resource Center could offer.
Now, in order to create demand, we need to we have web-based marketing here. It's one of the ideas we propose in order to spread the word about our new services. Specifically, we propose utilizing Spotify and Pandora. There are 2 music streaming applications that are really popular. They can pinpoint users by age, sex, and zip code, allowing you to find your targeted demographic. In addition, the average cost is about $12 per 1,000 impressions. We also propose using Facebook and Twitter, also social media giants there. Average cost for ads there is a lot cheaper. As you know, almost everyone on Facebook and Twitter nowadays, so it'll be really useful to reach the local public. We also propose using advertising. This involves advertising in local neighborhood newspapers such as the Walk Weekly, Parkinson's People, and the Dallas Voice. This will help us spread our message to our targeted demographics as well. We also propose creating offers for free one-time consultations through Groupon and other Groupon websites. The objective here is to create an incentive for people for people who are curious about our services to check it out risk-free and at low cost. And finally, most importantly, we really believe in developing relationships in order to really again spread the word about our new program. We want to establish relationships with local universities, community colleges, and such. And really the hope here is that with relationships set in stone, they can refer staff and students here to the Resource Center for those who receive help and treatment. And also creating relationships with medical centers and HIV testing centers in order to really distribute benefits and such.
In conclusion, we strongly recommend that the Resource Center implement both the Resource Center Behavioral Therapy and the Be Well Health and Wellness Program to expand their behavioral health services. The Resource Center Behavioral Therapy generates revenue and provides high-quality counseling, while the Be Well Health and Wellness Program expands reach to new demographics, increases the services offered, and also raises the profile of the Resource Center within the Dallas community. We would like to thank all of the individuals on this slide for their incredible support and information in the development of our case. And that is all we have. Thank you so much for being here, and we'll now open the floor to questions.
We have 10 minutes for the question.
Could you go back to a slide where you told us about the sliding scale adjustment for student intern services?
That's slide 11.
My question is, you're suggesting pushing the up side of the scale to 150. I'm not sure, but 125 per hour. falls within that.
Correct. So we don't want the SMU and volunteer counseling to cannibalize our core business.
Uh-huh.
In order to do that, we're incentivizing someone who does not have private insurance by offering a lower cost for the LPC service. This is so that when a client would walk up to the Resource Center counseling, they would have to, if they did not have private insurance, they would have to decide whether to pay $125 but see a licensed professional counselor during business hours, or pay $150 to see a SMU graduate counselor after hours and on weekends. It's more of a time shifting incentive that we're trying to prevent. And so rather than, we're trying to prevent someone from making the decision rather than skipping work, they would rather have after hours or weekend care.
What's the likelihood, you think? I mean, it's sort of like someone going to a cosmetology school and having their hair cut by someone who maybe has 6 months of training versus paying. Do you think you would get the same result by keeping your sliding scale for student interns and people who maybe have higher need or higher income would choose not to go? Do you really think there's likely to be competition and cannibalization, I guess is my question.
I think we did think that there would be cannibalization of business, which is the reason why we have this built in. We wanted to put in every roadblock possible to prevent that. This would provide the 0 to 50 sliding scale and the $15 average copay that's currently being used. We don't see those numbers changing that much because this $150 high end would never be used except to prevent cannibalization.
Marissa, I'm curious what your reactions are, given a lot of the new ideas.
So first, let me make sure I understand on the behavioral therapy services. Were you recommending expanding services aside from the wellness program? Are you thinking of also adding substance use?
So substance abuse would be built into what the licensed professional counselor can do. What we're not suggesting is medication management in hiring a psychiatrist. We feel that would be just too big of a leap currently between services offered currently and what we can foresee being feasible. But yeah, substance abuse would be involved in the licensed professional counselor's work. There's a certain line that we have to be careful we don't cross, because sometimes substance abuse detox requires a more medical clinic. That was something that we are not suggesting the Resource Center do at this time.
And so, I'm not sure I completely understand on the interns being in the evenings when they have to be supervised. So somebody would have, LPC would have to be there.
Yeah, so the current relationship
would that not create a barrier to, in some instance? I mean, I'm not sure somebody would pay an intern $150. Is that what you're saying?
That's the point of the model, is so that somebody wouldn't make that choice to pay $150. They would rather either use their medical health insurance or pay $125 out of pocket to go see the licensed professional counselor. The reason why we have the high end at $150 is to prevent people from having to make that decision to see a student counselor, and we think that this cost is high enough to prevent that from happening.
And was there ever any I'm just curious, one, if you thought of it, and if you didn't, that's fine. We could also expand services by being a licensed, be licensed to provide substance abuse services, which is an LPC, would be an expansion. Was there any, why not that? Why not that?
So when we talked to Sabine Rakos, she expressed some concerns that the steps that it would take to cover full-blown substance abuse cases, especially with detox, would require too many medical professionals to be financially feasible for the Resource Center. It also requires differences in infrastructure. You have to have locking doors. You have to have like significant locking mechanisms on all of your doors in case somebody was to have a negative reaction to the detox.
And is detox required for all licensed programs? Is it required that you provide?
I'm not sure.
Okay.
We didn't do that research.
Okay.
So I really like the fact that you looked at cannibalization and just thought about it and the different kind of break-even points. I had no idea if that's the right level, but it makes sense to me that you would want to make sure if you're expanding to a new kind of segment. I really liked how you looked at what that segment is, what the per capita income is, and kind of what they look like, and the fact that there's a big market in Dallas. That all looks really good. So I don't have any questions there. The other part of it, all the other ideas from yoga to music therapy. I don't know what that is, but it sounds interesting. I guess my question is really, more for you, Marissa. Like those are services that I think maybe aren't offered today. Do those sound viable for the new facility, or like are those? What intrigued me was that it could potentially get new people into the building and
Right.
referring to.
And so if you took this plan and you were helping us implement that, when would you see that rolling out? Like how would you see that progressing? Would you do it all at once? Would you see it phased? If so, how and at what point? And how do you have to be in mental health counseling before you can participate in the wellness program, or does it matter?
So we thought that we would start as soon as possible, and we looked into a few of the LinkedIn profiles, and there's a large amount of art therapists and music therapists.
So who would manage all of that?
We would put a volunteer coordinator in charge of that.
So that would add additional staff person?
Well, is that?
So the idea of the Be Well program is that it's flexible in terms of what volunteers are available. And so these programs, the yoga program, Zumba, these are just examples of fitness programs that could be underneath this umbrella that we're calling Be Well. There's flexibility inherent in the design of the program, so that if you have a yoga instructor come in and they live in Dallas for 2 years, they could teach yoga once a month. And then if they move away, we could find either a new yoga instructor, or we could find a different kind of class to fill that gap. The idea of Be Well, though, is you don't have to be enrolled in the behavioral or the mental health counseling to be a part of this program. This is meant to be a program to both bring in new demographics of people into the Resource Center and also offer a wealth of expansion of services for your current clients. I don't know if it was, emphasized, but there would be a $5 monthly membership, and this would cover the cost of the administration of the program. But we would have both member-only classes and then public classes. And if you can imagine, those public classes would be in conjunction with Clyde Warren Park or the ISD school districts in the area, different community partners to partner with the Resource Center and kind of put on some of these Be Well programs. I'm sorry?
Yeah, I was going to, on the same point, I think on something like that, your total is $1,600, right, of revenue. So the question is, if you're going to take a shot like that and change, do you guys really believe it's going to be big? And if so, do you think 1,600 is the beginning, or do you think it could be bigger?
I think 1,600 is just the beginning. That's just based, like for the art therapy and the music therapy program, that's just based on we made assumptions that it's at a very minimum client amount. Like the art therapy program, we would break even at only 4 clients at 5 clients. I
think one benefit of the numbers are on the more conservative end. The fitness program, that model is based on 20 clients, and a running group can have a pretty much infinite number of clients. So that is just conservative numbers. We talked about just starting the program small and then getting buy-in within the Resource Center and the clients and the volunteers that the Resource Center currently utilizes and serves. And once we get community buy-in within the Resource Center, we can expand services by reaching out to volunteers with specific expertise in these areas.
And the programs would also grow with the increased demand if we use the commercial models.
And you're not concerned about brand dilution by stretching to this big wellness model versus what the Resource Center does currently?
Right, and so that's why we would start small and then expand from there.
Great. Thank you very much.
Thank you all so much.